Hey everyone. I wanted to talk to you today about IBS, Western medicine, and Ayurveda. And Ayurveda is, I think, very potentially promising treatment plan for people with IBS. It's the Indian traditional healing system, and I have a lot of reason to think that has a lot of promise to treat IBS. And I'm going to tell you a little bit about why. So I actually came to Ayurveda somewhat recently, and my background is in biotech. And the reason I got interested in Ayurveda is that I'm always interested in new ways of thinking about preventing and curing disease and new knowledge that can help us, crack open a disease that we weren't able to crack open before. Originally in biotech, I was actually working in on the field of aging, how to reverse aging and slow down aging, which is kind of a similar thing. It's a very contradictory or contrary way to think about disease compared to the modern approach of just treating a disease, you just reverse aging. More recently, I've actually been interested in Ayurveda, and the way that IBS connects to Ayurveda is that when I started talking to doctors about, what diseases can be really well treated in Ayurveda that Western medicine can't really treat, IBS is a pretty common disease that I heard of, and the Ayurvedic treatment, doctors' perspectives is that it's actually pretty easy in Ayurveda. There's a lot of reasons for that, and I'd love to share what I found after I did some digging and talked to doctors, researchers, and so on. Quick disclaimer, I'm not a doctor. I talk to doctors, I read papers, I read the stories of patients, and sort of try to put things together so that I can communicate them to other people and be of service. And so if we talk about what exactly I learned about IBS when diving into it and the way that Ayurveda can treat it, I think I'll start off with some of the scientific evidence for my more rationally minded audience or scientifically minded audience like to see the evidence. I think there's actually two pretty promising pieces of evidence that I've come across. There's a German clinical trial that tested an Ayurvedic diet versus the low FODMAP diet, which is kind of I'd say the state of the art in dietary approaches to IBS. It's sort of one of the gold standards in the current Western medical consensus. And so the Ayurvedic diet actually did significantly better than the low FODMAP diet. And the interesting thing is it's way easier to observe. The Ayurvedic diet has less restrictions and it performs significantly better. And so I think that's very interesting because the low FODMAP diet is basically the edge of what Western science will, at least from a dietary perspective, prescribe for IBS. And the Ayurvedic diet is actually only one part of full Ayurvedic treatment. The full Ayurvedic treatment is it's diet, it's medicine, and it's a series of procedures that can be performed at an Ayurvedic treatment center called Panchakarma, where they basically detox your entire GI tract. They use a bunch of methods to be able to do that. And so a common misconception about Ayurveda is that it's just diet, it's just medicine, but it's actually all of these together. So the full effectiveness of the whole system should actually be significantly better than just the diet. And the diet is already performing very well in this clinical trial. I think the other piece of significant evidence is that there was an Indian clinical trial in which they tested Ayurvedic treatment, and the sort of results that they were able to see, the decreases in IBS symptom severity were significantly better than you see in Western studies. So you had a huge chunk of patients basically be entirely cured of IBS, like no recurring problems after a course of treatment with Ayurvedic medicine. And again, the medicine is still just one part of the overall treatment. And so this trial is just testing the medicine. And so we see in two trials, we have one trial that's testing the diet, one trial is testing the medicine. Both of them perform significantly better than Western medicine. So I think the evidence, from a scientific perspective, I wouldn't take this evidence to mean we solved the case, but I think it's enough reason to say, especially for people that have had IBS for years and are suffering, that look, we should probably take a look at Ayurveda and see what the promise is. The last reason is sort of from the perspective of Ayurveda itself. Ayurveda views the digestive system as really central to health. It's kind of the main thing that Ayurveda tries to go in and correct, which means it has a really good understanding of the digestive system and the different things that can go wrong inside of it. This is very interesting from the perspective of IBS because in the Western scheme of things, there's not really an understanding of what causes IBS in a particular patient or even a large scheme of patients. We kind of try to treat the specific symptoms. We'll give you medication to try to trigger bowel movements. We'll give you medication to try to reduce depression, psychological side effects. We'll give you medicine to reduce the pain from IBS, but we don't know what's causing it in the GI tract, in the digestive system. But when you talk to Ayurvedic doctors, they look at IBS as something relatively simple to treat in the Ayurvedic scheme of things because they'll look at you and they'll say, you have these 4 digestive imbalances, these are the 4 things, and we're going to target medicine at each of those imbalances, see what we can do. You have low digestive ability in this tract, this, and this, and then they'll go after it and try to treat it. So that's a pretty striking difference from Western medicine, where Western medicine is trying to look at doesn't really know the causes and is trying to look at just the symptoms. So I think those are the reasons why I think there's really good reason to believe in the promise of Ayurveda for treating people, especially in the U.S., who are suffering from chronic IBS and are sort of inside the Western medical scheme of things and haven't found relief. And so the other thing is that if you have IBS or if you're just curious in any way, I would very, very much value being able to hear from you and hear what you need, hear just the way that your treatment has been, hear if this video is of any value to you, hear what information would be valuable to you and what I can learn and try to bring to you and try to find out for you, because I think that would make me really happy if I was able to really understand what people cared about and bring things to them that impact them for the better. So thank you.